Can cell therapy revitalize dysfunctions of organ systems or organs? Mr. President, dear colleagues, ladies and gentlemen, what is cell therapy? Cell therapy is a biological therapy. It is defined as an injection implantation of fertile or juvenile cells and tissue particles or peptides in physiological solutions. However, it must be pointed out that cell therapy, like any other medical trend, should be part of a comprehensive, holistic concept. The more this therapy with biological components is embedded into a number of necessary concomitant measures, the more convincing the effect will be. The purpose of cell therapy is not to remove a conspicuous symptom, but the elimination of the cause of the symptom. Not only the affected organ, but the entire complex of organ regulations should be taken into account. Cell therapy and revitalization. There is a concept of body, soul, and spirit. The endeavor to retard or to repair losses of somatic and mental functions due to age has been a very old wish of medicine. Tales and legends of the fountain of eternal juice or the magic drug are expressions of this human wish dream. In fact, the therapeutic endeavors do not aim at rejuvenation, but at the re-establishment or improvement of biological functions, the total capacity of which is referred to as vitality. If vitality is interpreted as optimal performance to the functions existing in a living being, revitalization means a re-establishment of lost functions. But vitality is moreover a concept comprising the total organism with its triad of body, soul, and spirit. The leading symptoms of devitalization are lacking initiative, loss of activity, rapid exhaustion, reduced physical achievements, reduced psychological reactivity, reduced tolerance to alcohol, and reduced tolerance to nicotine. Although these dysfunctions relate mostly to partial spheres, difficulties in finding words, disturbed potency, depressiveness, the term loss of vitality means the restricted vital expansion to the entire personality. We have more loss of ambition, reduced self-confidence, unfounded depressive ill humor, dullness, despair, lack of concentration, impaired memory, insomnia. This must be taken into consideration when optimizing a therapy. But the optimized therapy must not rely on single parameters alone. More important of all is that the patient expects a treatment in order to feel subjectively better and free from complaints. A general revitalization therapy, that's our treatment plan. First for women, power cells, that means long-term but smooth, 6 injections per week. That means brain, heart, umbilical cord stem cells, total organ mix, adrenal gland, liver, spleen, placenta, ovary, thymus, should be repeated after 3 to 6 months, or take premium power cells with a short-term therapy but strong, 10 injections in 1 session with the same products. And for men, power cells, long-term but smooth, 6 injections per week with brain, heart, umbilical cord stem cells, total organ mix, adrenal gland, liver, spleen, placenta, testis, and thymus should be repeated after 3 to 6 months. Or the same cell therapy with premium power cells, short-term but strong, 10 injections in 1 session, and should be repeated after 6 to 12 months. The treatment and care of aging persons is medically and sociologically in the teething stage. The futile postulate to integrate old people into society is mostly completed by the doctor's advice to take longer walks and by the prescription of polyvitamin trace elements. However, the therapy must aim at the entire individuality and the training of the somatic, social, and mental capacities. This should be given priority. The function of cell therapy consists in the regeneration of performances of the organs and organ systems affected by synthene. Common dosages are 70 mg per vial or 150 mg per vial of lyophilized or deep frozen cell factors. These combinations provide good results in the revitalization but do not meet the differentiation of individual cases. The following survey is intended to show possibilities of rendering the revitalization more individual with regard to the symptoms. You have some selection of tissues according to symptoms in revitalization therapy. That means, for example, the symptoms on the left side, disturbances of rough movements, should be taken cerebrum, cerebral cortex, spinal medulla. Or vascular sclerosis, take placenta, artery, umbilical cord, stem cells. Or disturbed potency, take testes, adrenal gland, hypothalamus, liver. Or degenerative changes of skeleton and joints, take cartilage, bone marrow, umbilical cord stem cells, placenta, thyroidea. Or insufficient immunity, take thymus, adrenal gland, spleen. This is a direct relation between the symptoms and the tissues to be selected. Care must be taken that for an individual treatment, usually not more than 10 to 12 cell factors are used, as otherwise the stress after the implantation would be too great. These combined tissues can be distributed in 1 or 2 simultaneous injections. The more weakened, run down, and emaciated a patient is, the more he needs a good preliminary examination and a methodical after-treatment. Fatiguing physical work and brain work should be avoided within the phase of stress of 3 to 5 days. Medicaments stimulating the metabolism, combination of polyvitamin trace elements, membrane activators, neurodynamics, or an biological basic and enzyme preparation ought to be included into the after-treatment. Repeated treatments as part of the revitalization are necessary at intervals of 3 to 6 months, depending on the individual case. Often the question arises from what age revitalization can be looked upon as reasonable. There's a difference between biological debit and credit. The earlier revitalism measures are taken up, the more vitality persists. And the normal age of 30 years of age can be genetically go to 120 years. The individuality of the synthene must be taken into consideration. Generally, a revitalization will be more effective the earlier it begins and the more regularly it is effected. The 5th decade of life is regarded as the optimal age for the beginning of a revitalizing therapy. Measurable results are also obtained if a treatment is started in the 8th or 9th decade, but it should be realized that already existing degenerative processes may restrict the expected degree of the therapeutic improvement. Revitalization of cardiovascular disorders. Well, we have a successful treatment of arteriosclerosis, vascular and coronary sclerosis with placenta cell factors. Kuhn and Knüchel saw fundamental clinic studies. The lipoprotein and cholesterol levels subside in 64 patients with arteriosclerosis within 4 to 6 weeks after injections of placenta cell factors. Stepanschitz and Schreiner found objective and subjective improvement in 8 patients of 15 having vascular sclerosis treated with placenta. The ergometrically, oscillometrically, and radiographically registered improvements persisted for at least 8 months. Kleinsorge used the walking distance, the skin temperature, and oscillography to substantiate the therapeutic results. General conditions and nocturnal calf pains were assessed subjectively. The walking distance was doubled within 4 to 12 weeks after injection of placenta cell factors among 21 patients in 8 cases and tripled in 3 cases. 3 persons were virtually free from complaints. These improvements persisted for 13 to 16 weeks in the majority of cases and up to half a year in 4 cases. We have a treatment plan for cardio and vascular disorders. Shown woman with power cells, long-term but smooth, 6 injections per week. Premium power cells, short-term but strong, 10 injections in 1 session. And for men, nearly the same, power cells, long-term but smooth, 6 injections per week. Premium power cells, short-term but strong, with 10 injections in 1 session. It is different only for women, ovary, and for men, testis. Of 72 cases treated by Ötzmann with placenta or placenta, liver, and testis cell factors combined, 58 showed improvements. Reactive hyperemia, changes of skin temperature, lowering of cholesterol levels, and increasing walking distances were registered. Brandner divides his observations into 19 cases of general sclerosis and 17 cases of coronary sclerosis. In cases of preceding complaints of 3 to 4 years, the results in coronary sclerosis were better. 15 cases free from complaints, 1 temporary improvement, 1 failure. That in general sclerosis, 9 free from complaints, 6 improved, 4 failures. As rates of success, Ötzmann quotes 73% of 150 patients, Kuhn 67% of 700 patients, and Ritschl 72% of 93 patients. For coronary sclerosis, Brandner examined 9 of 17 patients 1 year after the cell implantations. 5 showed improved ECG, 4 no changes of ECG, though they were free from complaints. Cardiac insufficiency. Our treatment plan is for women and men together. Power cell, long-term but smooth, 6 injections per week. Brain, heart, adrenal gland, spleen, lung, artery, liver, umbilical cord stem cells, placenta, total organ mix should be repeated after 3 to 6 months. Or premium power cells, short-term but strong, 10 injections in 1 session, with brain, heart, adrenal gland, spleen, lung, artery, liver, umbilical cord stem cells, placenta, total organ mix, should be repeated after 6 to 12 months. Whereas certain scientists regard cardiac insufficiency as a contraindication against cell therapy because the stress of the injection alone constitutes an additional strain for the organism, Utzman drew a more differentiation conclusion. In the classical postulate for limitation of cardiac activity, strengthening of the myocardium, diet, diuretics, he does not see any contrast in using cell therapy. Doses of heart, liver and placenta cell factors were used in degenerative disorders of the myocardium. Those implantations reduced, in the face of decompensation, the recompensation time. After a short phase of lassitude, the patients revived. Normalization of the blood protein levels and the calcium, sodium and potassium metabolism were analyzed by Schwer's, Raver, Uhlenbrock. However, fresh cardiac infections and all inflammatory heart diseases are improper to cell therapy. After an interval of 3 to 6 months and a clearly proved identification of scars, cell therapy is excellent for the blood circulation and promotes the concentration regulation mechanism of the heart. The regenerability of the myocardium by new buddings of vessels has been substantiated by impressive studies. Sexual revitalization, causes for male infertility are first mumps orchitis, orchidopexy,